Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Shirisha Kamidi, internal medicine physician. Today's Kevin MD article is Small Habits, Big Impact on Health. Shirisha, welcome to the show.
Thank you so much for having me today.
All right, so we're going to talk about your article in a little bit. Just first off, just briefly share your story and tell us a little bit about your practice.
Okay. I'm a triple board certified physician, certified in internal medicine, pediatrics, and lifestyle medicine. And currently, I'm working as hospitalist at Baptist Hospital in South Haven, Mississippi. My also interest is in lifestyle medicine as it can impact a lot in patients' health outcomes.
All right. So that's a little bit of a contrast, right? You're a hospitalist, but you also focus on lifestyle medicine. So you almost see two ends of the spectrum. The what if they don't follow lifestyle medicine? They could also end up in the hospital, right?
That's right. And I feel like as a hospitalist, there is a lot of scope to practice lifestyle medicine. When somebody's sick and in the hospital, they understand the severity of illness that they are going through. And at that time, if we provide lifestyle education, they feel like that's the right time to get that input and incorporate in their life so that they can make a big impact in their health outcomes.
Your Kevin MD article is titled Small Habits, Big Impact on Health. Now, I want you to talk about that article for those that didn't get a chance to read it, but what led you to write it in the first place?
So, as I said, I'm big on lifestyle medicine, prevention. And the reason why I wrote that article is because, like, in my life, I was diagnosed with gestational diabetes mellitus. And I experienced how diabetic life is, like checking your sugars, counting your carbs, restricting your carbs and eating more healthy food, incorporating fiber diet, calculating your protein intake and make sure you have healthy calories during your pregnancy. So when I was pregnant for the first time, I was diagnosed with diabetes and I was able to manage my diabetes with diet modification and exercise. And with my second pregnancy, I know I'm at a very high risk of gestational diabetes. So I was very proactive at that time and I started my lifestyle modifications even at the beginning of my pregnancy, and I was able to prevent it. So second time I was not diabetic, which had a big impact on how I see all these chronic diseases and everything. So that's when I strongly believe that we can prevent chronic diseases and we can even reverse chronic diseases by lifestyle changes.
So tell us more about your article itself. For those who didn't get a chance to read it, give us a few examples of some of the small changes patients can make.
So it's very small changes. We can start with like doing 5-minute walk every day and slowly increasing it like 10 minutes, 15 minutes then and 20 minutes. So slowly, like, taking small changes in life, like doing a 5-minute walk, starting to eat more vegetables, incorporating more fruits into your diet, and managing your stress, doing some relaxation techniques, having a good social relationships. All these things can impact our health. So I would strongly suggest everybody to start with small changes and consistent changes to have that impact on our health.
And that's really the key, right? Small and consistent. Because a lot of patients, especially in my setting as a primary care doctor, they want to make big changes and then they'll start off very strong, but eventually taper off, right? So I think having that small, consistent change would only add to the long term habits that they need to develop in order to keep at it.
Yeah, I can give you like examples. I have seen an elderly patient who had high blood pressure. It was like within my family. So they just approached me about this and they thought this is all from stress and their blood pressure will be okay once their stress is gone from their life. So I educated them that no matter what we are going through in our life, even if you're in stressful situation, your body should be able to keep your blood pressure within normal range. And if it is not, that means we are prone to have elevated blood pressures. And, if it's persistent, we diagnose with hypertension. So I have suggested her to have like a 20-minute walk, try to like eat more healthy food, and, focus on doing some yoga meditation. And she practiced those. And after 6 months, we rechecked her blood pressure, and she had a normal blood pressure at that point.
What's it like to incorporate lifestyle medicine in the hospital setting like you do? People who are sick enough to be in the hospital, it could be for something as common as pneumonia, acute coronary syndrome. What's it like to talk to these patients about lifestyle medicine when they are so sick that they are an inpatient?
I feel like they are more receptive when they're in the hospital, because they have no other job. They're not going to job. They're not rushing. They're not taking care of any other things, and they realize that they're in the hospital because their health is not right. So if whatever we tell them at that point of time, they're more receptive. So I take every opportunity to educate all my patients who are overweight and obese, to make sure that they understand why this happens, what's going on, and what we can do to make it better. And I feel like they're very receptive. And sometimes sharing my own stories to the patients makes a big impact too. Because when I tell them that, I was diabetic during my first pregnancy and I did this and I was able to prevent this, then they think, oh, this is realistic. Whatever she's saying is possible. So they feel like they are connecting to me more when I share my own personal stories. And I feel like we should take every opportunity to educate the patients and get some good health outcomes.
So we talked about walking as a small change. What other small changes can we suggest?
I I feel like adding more vegetables and fruits to our diet. So maybe start with one portion, adding at least making sure that I have one portion of vegetables with every meal, and I have one portion of fruit with every meal, and that can bring a whole lot of change in health benefits.
And in terms of sleep, that's another thing that is a big part of lifestyle medicine. Tell us about the importance of sleep and how you counsel patients to improve their sleep.
So as a hospitalist, I see patients with insomnia. Everybody has a mindset that, oh, I can't go to sleep. I could not sleep last night. I need medicine. And then I take the opportunity to educate patients that, sleep is more complex. It's not just simple thing that I can't sleep, I take medicine, that's the
Mhm.
end of the story. It's not that. Sometimes what happens is when these people are taking medications, at one point they get so used to and start developing like, resistance to that, which means that that medicine doesn't work on them anymore. And once they stop taking that medicine, they can't sleep. So that becomes a big problem. So I educate my patients that when we eat healthy, like, like dinner time, like at least 2 hours before sleep should be your dinner time. And what we eat also matters. Don't eat carbohydrate rich food, then you will not be able to sleep. You have your, sugar rush, so you will not be able to sleep. Limiting screen times, like you don't watch any screen at least 1 to 2 hours prior to your bedtime. That really helps. And avoiding naps close to the, actual sleep time at night also helps. And having exposure to sunlight during daytimes actually wakes us up. So we are in that circadian cycle where we are up in the morning, and by the end of the day we don't have that sunlight exposure, and your melatonin kicks in, natural hormone that helps us in getting good sleep. And having good sleep has a lot of impact on our health. Like it reduces our cortisol, our stress hormone, which impacts like your our blood pressures and other stuff. And also surprisingly, I learned that it has impact on immune system too. When somebody has good sleep, our immune system works better. So I feel like it has a lot of impact on our health.
You practice in Mississippi, and in your article, you talk about some of the unique local characteristics of the population, like strong community ties, right? So, how can that be leveraged to improve public health in the area that you practice in?
Um, I feel like when it comes to health, the community activities also play a big role. Like, having a community gathering where we can talk about how we can do like small changes, like, having a walk together or having like a small 2K run, 5K run, those kind of things also helps us in, educating that like activity is important, and that helps us in preventing chronic diseases and also to reverse the chronic diseases.
I love what you're saying. I think that your message that lifestyle medicine can be incorporated in every setting and not just the primary care setting that I'm familiar with can definitely be emphasized. And if you can do it as a hospitalist, there's no excuse that other physicians in other specialties can also include small tidbits of lifestyle medicine in whatever specialty they practice in.
Thank you.
So we are talking to Shirisha Kamidi, internal medicine physician. Her article on Kevin MD is Small Habits, Big Impact on Health. Shirisha, let's end with some take-home messages that you want to leave with the Kevin MD audience.
That small, consistent habits has a huge impact. And also want to make a point that these diseases start decades before we see them diagnosed. That's why I want to prioritize healthy habits in kids. It's really important to start being healthy when we are very small, because the disease starts when we are literally in the womb. So every habit matters.
Shirisha, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much for having me.